Well, hello and welcome to a clinical case analysis with Dr. Childress. Today I'm going to be providing a clinical case analysis of an AFCC vignette. That's the Association of Family and Conciliation Courts. And I recently took a training from them, this Advanced Issues in Family Law, Parent-Child Contact Problems. It was a set of 8 modules across 4 days. And the vignette, they used a training vignette, and it was presented in the first module, Parent-Child Contact Problems, by Dr. Ward and Dr. Droids. And so that's the vignette that I will be providing a case analysis for. Is the training vignette provided by the AFCC. Now, as a preface to my clinical case analysis of their vignette, I just wanted to discuss a little bit about the types of relationships in family, because that'll come into play in this family. Because there's 4 types of relationship in a family, and they depend on the gender of the parent and gender of the child. And 2 of those are cross-gender relationships, and those are your high affection bonds. That's mother-son and father-daughter. And then 2 of them are same-gender bonds. Those are your values and identity bonds. That's the father-son and the mother-daughter. And so in this AFCC vignette, you'll see both of those types of dynamics at work, because the son has a distorted or an enmeshed high affection cross-gender bond with his mother that excludes the balancing influence of the same gender bond with his father, who's rejected by the son. And in psychoanalysis, that would be called an Oedipal victory, in which the son becomes the mother's noble warrior and defeats his father to win the mother's special affections. And in this AFCC vignette, you'll also be presented with the middle daughter, who has a distorted same-gender bond with her mother, leading to identity destabilization. So I just wanted to point those out prior to starting the analysis, so I can talk about them once we enter the case itself. So this is the first presentation, the first slide presenting the vignette that was used at the training. So it's a PCCP, Parent-Child Contact Problems Training Case Study. And it involves Sonia, a mother, 42 years old, and she's a nurse. Joe, the dad, is 44. He's a police officer. Nick, age 15, ADHD diagnosed by age 8, resisting contact and eventually refusing contact with his dad. Danielle, or Danny, age 12 and a half. They have gender identity issues since age 7. Then we have Brian, age 7, the third child. He's forgotten third child who goes along and tries not to ruffle any feathers, not pictured in the various reenactments they did of the case vignette. So he wasn't pictured in the reenactments, but is referenced in many of the clips. Separation occurred when Nick was almost 15, Danny was 12, and Brian was 6 years old. So in presenting cases, that's typically the format. You present the age, occupation for adults, or gender, ethnicity. And that's one of the things that's missing here, is a presentation of what culture, what are the cultural backgrounds of the mom and dad. And that's a very important consideration when you're considering families. So this introductory slide should actually also identify the cultural backgrounds of both parents. And to say something about culture here is culture is broad and expansive. And even if the 2 parents come from the same broad culture, white or black or European, Asian, something, they're still family cultures that they are integrating into their experience family histories, family legacies, and things, and the rippling of transgenerational trauma. And so those cultural background issues are always important to understand in working with families. So now, what I will do is I will read each portion of the vignette, and then I'll go back through and provide what this clinical psychologist would note about that information. And let me pull this back up again. I use vignettes a lot when I was teaching. I've taught courses in diagnosis and treatment and a bunch of different psychology courses at the graduate level. And when I'm teaching graduate students, I'll use these case vignettes there to train or teach the graduate students. And one of the things I instruct them to do is, as you're going through vignettes, and vignettes are used a lot in graduate application processes to doctoral programs and stuff, because they're a useful way to get information about how the would-be clinician or how the clinician analyzes information. How do they think about clinical information? So you give them a nice structured vignette and then watch their thinking process with it. And my instructions to the grad students is, when you're presented with a vignette, go through each bit of information and associate to it. And to sort of understand what each bit of information, the information that it provides, relative to a differential diagnosis and all the things that you might be considering regarding the case. So you associate to each bit of information, and then certain domains will begin to group out as you go through. That would be the more likely diagnoses in a situation. So for this particular presentation, first off, I would note it's a training case that the AFCC uses. I would note the parents' ages at 40s and mom's a nurse and police officer. The value of or the importance of them both being 40 and that they got separated when Nick was almost 15 is this is a long-standing family. This is not, a brief episode or a brief affair and the parents had a child or maybe two and then quickly divorced. This was a family that got together and decided they'd be together for a while. In addition, they're both in relatively solid professions. One's a nurse, mom's a nurse. It's a caregiving profession. Father's a police officer. Now, again, with the police officer, that's a culture. The police officers and the military and the firefighters as well, to a degree, have a sort of a military mindset. It's a culture, strongly masculine culture. So there's a gender cultures involved with masculinity. And with police officers, military as well, but with police officers, that's a high stress role. And so you get a lot of complex trauma kinds of stresses with them, family problems, potentially alcohol problems. Plus, they can't get into any trouble because they carry a weapon. And if they get in trouble, that could affect their employment. And so there's a whole culture around police officers that's important to understand when working with police officers and their families. And so that's another cultural consideration. So I would suggest in this matter, if you're not familiar working with police officers, I am, but if you're not, then I would seek out consultation with somebody who is, and just talk to them. What are the features that I should be looking for relative to assessing a police officer in a family context? Another consideration here is we have Nick, who's 15 years old, and he was diagnosed with ADHD early on. Now, at age 8, third, fourth grade, that's a lot of times where it comes up. But one of the differential diagnoses for ADHD is an attachment problem, because attachment will mimic those symptoms. It's an anxiety issue. The attachment system is a predator-created system. It's an anxiety-driven system. So when you have insecure attachment, you will develop insecure, anxious, ambivalent, insecure, avoidant. or disorganized attachment. And anxiety shows up as restlessness and inability to concentrate, which are the symptoms of ADHD. So one of the first questions when I hit ADHD is whether or not that's an accurate diagnosis or whether we might have attachment issues in the family. And they emerged with the eldest son around third grade, maybe, is when that became a problem, likely for the school or likely with his schooling. But he's now 15, so we have a long history of treatment response, hopefully, and see what happens with that. The other issue on Nick's presenting problem is he's refusing contact. Now, that puts it in the domain of an attachment pathology. So when a client's coming in, you want to look at what category are we dealing with? Autism? Is this an ADHD issue? Is this a attachment issue? Eating disorder? Substance abuse? What's the category? Depression? Anxiety? In this case, we're looking at a family conflict. The child has ADHD, but that's a secondary consideration. What we're really looking at here is the attachment pathology, the child's refusing contact with his father. Then the middle child is 12. She's just going into adolescence, and she has gender identity issues since about the age of 8, which is interesting. You typically don't see gender identity issues in an 8-year-old or 7 or 8-year-old, 9-year-old. That's an unusual presentation. It's notable that she has not entered puberty yet. And there's a whole bunch of family dynamics we'll kind of get into around this discussion. But that's an unusual presentation. In addition, it opens up another cultural issue, which is the LGBTQ domain of things. So if you're not, as a therapist or mental health professional, if you're not familiar working with transgender or gender identity or LGBTQ issues, then you should be getting out to consult with somebody about that. Just don't start doing stuff with people and not know what you're doing. So there's two subcultural features involved with a police officer father and a potentially gender questioning daughter, and as well as no identification of the broader cultural backgrounds of either parent. So cultural factors would be considerable in this situation. Consultation probably recommended. Then we have Brian, who's the youngest, age 7, and then they divorced when Nick was 15. Now, one of the first things I'll look at with this family structure, not only is it a long-standing family structure, these parents got married and intended to stay married. They intended to raise a family. 18, 20 years together, 3 children with this situation. And now we have, as it presents into the mental health system, we have the eldest child who's at 15, he's going into the launching phase. So at 16, 17, 18, he should be leaving the family and leaving the home. So he's in the launching phase of development. We have the middle daughter who's just coming into adolescence with gender identity or questioning issues. So that's going to be a complicated situation during adolescence. And we have a trailing child around 7 or 8 years old. So whatever, we need to fix this family, because we got a 7-year-old trailing up. And, so while the oldest child may age out of court considerations, we still have a younger child. So attachment problem, something like this. When I was clinical director, if I'm overseeing or supervising this case, I would want a treatment plan for about 6 months, no longer than a year. I'd like 6 months to a year. I'd like to get everything kind of stable with this family. So now the next information about this family, this is sort of their presenting opening slide. Family case study. We've offered you this case study that highlights a high conflict family dynamic where parental disagreements over parenting styles, identity expectations for the children, And lingering marital resentments create an environment fraught with stress, misunderstanding, and emotional harm. We have introduced actors, attorneys, a pediatrician, and a family therapist, each with their own biases and limitation. The challenge lies in creating a collaborative, child-centered approach to reduce tension, improve communication, and support the children's emotional health amidst ongoing legal and interpersonal conflicts. So that's, from a clinical perspective, that's not exactly the goal. The goal is to accurately diagnose the pathology so you can effectively treat it. But this, as you can see, they're presenting this within a larger context. And over the 8 modules, they did quite a bit of discussion of this. They've also filmed up videos of a whole bunch of actors playing the various roles. So they use this for an extensive training in parent-child contact problems, which doesn't actually exist. It's not a real diagnosis. Then they go on to present the summary of Sonia's background. And mom experienced emotional neglect and favoritism in childhood, leading to feelings of inadequacy and insecurity, affected by her parents' failed marriage and strained sibling relationships, leaving her longing for belonging and validation. She developed strong compassion and empathy, channeling her pain into helping others, attended nursing school, and now works in a community hospital, determined to build a better life despite her difficult past. So let's take a look at mom's background here. First off, I'd noted this child-centered kind of approach. That's problematic. We want a accurate diagnosis and effective treatment plan. Everybody's child-centered. Everybody wants to protect the child. And when you have a child-centered mindset, one of the important features about child-centered is a duty to protect. So that's a consideration in all treatment of children and everybody, but especially around children. So first off, on mom's background, we have emotional neglect and favoritism. Now, in childhood. Now, what is emotional neglect? Okay, that's a little unclear in its specification. So in a clinical interview, you'd want to go a little bit further into that. And favoritism. That's another interesting dynamic here that plays in. And what we're considering on this is that the mother's own childhood trauma issues have affected her thinking and perception. And so she's bringing in internal working models or schemas from her own childhood background into her perceptions and interpretations of current situations. So neediness from the emotional neglect, favoritism, maybe, I'm not sure quite how that's going to play itself out. But here's another concern. With an emotional neglect, the concern would be possible sex abuse. And here's why. Is she referring to the fact that her parents were not, or her mother was not did not adequately supervise her during childhood and exposed her to abuse? And that's what she refers to as emotional neglect. Is she using euphemisms? Because when you're interviewing a client for the first time, they don't disclose, or they may not feel comfortable disclosing deep secrets such as sexual abuse, especially if she never disclosed it at the time and hasn't since then. Then when she gets in the interview situation, she'll call it, I was emotionally neglected. My needs weren't met, which could have implications of making her highly protective of a child in this situation, or seeing the father as dangerous when that's not the case. And then the second is we have inadequacy and insecurity on that. Now, those two, inadequacy, would raise the issue of possible borderline pathology. So we have attachment problems in childhood that have distorted her self-image, self-security, self-identity. And so she's feeling very anxious and insecure. So we may have borderline spectrum issues. And that would also raise the dark triad, the vulnerable dark triad, which is vulnerable narcissism. She'll present as one down, and have people taking care of her. Then the type 2 psychopathy, which is highly manipulative. So that's psychopathic manipulative kind of features. And then the borderline spectrum pathology, fear of abandonment, role reversal, diffusion of boundaries, kind of things, emotional regulation issues, using the child to stabilize her emotional regulation, all those sorts of things. Then longing for belonging and validation. Okay, there's your fear of abandonment. So I'm starting, just off of mom's history, I would put borderline spectrum on the table. And then the next piece where they talk about her developing strong compassion and empathy, that's not consistent. Okay, children who are neglected and sibling right, they don't develop empathy. They have damaged empathy. Let's put it that way. I worked out early childhood. The way you develop empathy, the way empathy is taught, grown, scaffolded, is by providing the child with empathy. And empathy is a bidirectional channel. So if you're provided with empathy, then that builds your empathy networks that you can provide it to others. If you've never had empathy, then your empathy is damaged, because that's how it's built. You're given empathy. So if we have a neglectful parents, that's not a child who develops empathy. What this then suggests is that the mother is presenting as being intensely empathic. So she's a nurse. So she sees herself as very empathetic when she may not be, which would suggest a boundary dissolution. So she's got projective identification. She projects her own experience into the other person or into the child, then identifies it with it and says that fusion of psychological states is empathy, when it's not, when it's a boundary dissolution. So again, my concerns for borderline pathology with the mother are starting to rise. And then she's channeling her pain into helping others. That's your classic using others as a regulatory object. So she takes her own pain, gets other people in pain, and takes care of her own pain by taking care of others. So the concern is she's going to produce pathology in the child, anxiety, and then take care of her own anxiety by taking care of the child's anxiety or something like that. There's your factitious disorder imposed on another. Is she creating pathology to take care of the child? Oh, wait, we have a child with ADHD since age 8. Is she manufacturing the ADHD? Do we really have an attachment pathology and she's creating a medicalized child, a needy child, because she needs to be in the caregiver role? So those are all the considerations that you draw off of Vignette. You start associating and you begin to now, none of those are definite yet, but they're all considerations by the information. And as more information comes, certain explanations will begin to arise as more reasonable. And then she attended nursing school, determined to build a better life despite her difficult past. That's your virtuous victim presentation. Despite her traumatized past, she's determined to build a better life for herself. So she's presenting, it sounds like she's presenting significantly to the interviewer here as being highly empathic, this wonderful person, so loving and caring of other people, taking care of them, nursing to heal their pain, the virtuous side of things. And then she's going to be the victim in the family, the virtuous victim presentation, which is associated with dark personalities, the dark triad. Narcissists will be virtuous. They'll present as virtuous, but they won't present as victims. That's a narcissistic injury. The psychopath will present as victimized because that's manipulative, but they don't know how to present as virtuous. The dark triad and the dark personalities will present as both the virtuous and the victim, because that's the most manipulative. It is extraordinarily manipulative, that presentation. So now, Joe's background. Well, who's Joe? He grew up in a volatile, verbally abusive father, leading to low self-esteem and a fear of failure. Learning to equate strength with suppressing emotions and exerting control, influencing his later parenting style. Took on a protective role for his family, showing adaptability and duty. Struggled with temper control and misused alcohol in his late teens. Pursued a career in law enforcement, attended the police academy, and working toward becoming a detective. Both Sonia and Joe have a number of a number of trauma history issues, adverse childhood experiences in their background. So let's talk about Joe for a second. Go over here and pull up Joe. First thing, he grew up in a volatile, verbally abusive father. So he's been exposed to violent trauma. And the different types of child abuse will have different effects. So mom was exposed to neglect, so she's become very needy of things. Dad's been exposed to violence, that tends to produce tougher kind of exterior, potentially more prone to anger or violence. And they note the alcohol use in high school, or when he was younger, and now he's 40 years old. That seems a little superfluous. When you have a 40-year-old police officer, their alcohol use in late teens is not a relevant consideration. We've had his 20s or 30s. We have long experience if he's going to be an alcohol problem. So that suggests somebody's bringing up alcohol problems, because it's gotten into the voice of whoever is conducting the interview, when it's not really relevant what his alcohol use was in late teens with a 45-year-old police officer working to be a detective. So it sounds like maybe the interviewer has been captivated by the virtuous victim presentation of the mom, and that dad's, and notice too, that bring up his anger. Now, anger in a couple's relationship is very suspicious, and here's why. Oftentimes, the one person provokes the other one to anger, and then sits back and say, "Look how angry they are," but really they're provoking the anger, and it's very manipulative. That's your classic borderline: provokes to the anger, and then sits back and says, "Oh, you're being so angry at me. I'm the victim." And so we would wonder about, is the mother doing anything, saying anything to provoke him, and then offering him up as angry, inducing anger pathology in him? And particularly around borderline spectrum, we would begin to look at a thought disorder potentially, where what her reasoning isn't linear. And that could be very frustrating to the father, the male, who wants to be linear. Things are important to him. He's trying to get, and mom is doing these emotional kinds of thinking things. And so that could provoke the anger. Then mom plays victim on it. So be suspicious about that anger. However, we do have a history of angry father. We do have the police. We do have culture. And we have reports that he's angry. So we would want to rule out physical violence. Is the father any physical violence with the mother, spousal abuse, intimate partner violence, physical kinds of stuff, degrading, controlling? But more so, we're worried about the parent, because the marriage is over. We're worried about the children. Does a father represent a physical abuse risk to the children? If not, then parents have the right to parent according to their cultural values, personal values, religious values. If the father is a masculine guy and wants to elect masculine values with his son, that's his right as a parent. That's not a matter for psychologists and custody in the courts. We can put it on a treatment plan if we want, but that parents have the right to parent according to personal values, religious values, cultural values, and this would be within the scope of his personal values if he's not physically abusive or endangering the children. We'd want to look at the anger. How often is he angry? What's the intensity of the angry? And we might put it on a treatment plan. We'd also want to look if he's separated from the mother. Is he still angry, or is it interpersonal anger and mom is maybe provoking him? We could do an applied behavioral analysis with both the mom and the dad around one of these angry episodes and find out exactly what's going on that's cueing his anger. Now, anger is also hurt. So as I would, if I had this in therapy, with couples therapy, if dad is getting angry, I would take that and reframe that as this really being important to him. You love your family so much. Your children mean the world to you, and you'd really like a close relationship with your wife. She means the world to you. And it's really frustrating for you that you can't achieve that because these are the most important people in your life. And so reframing it over to his bonding desire and frustration with the bonding desire, rather than just free-floating anger as if he's just, an out-of-control human, which is how the borderline sees things, because it doesn't make sense. They're unable to mentalize the experience of others, lack of empathy. So what other people do seems random to them. They don't understand the motivations underlying that. And so when people get angry, they're just being abusive of me, replicating the abusive man kind of fears. Strength and suppressing emotions, that's his value system. While that, that he learned to equate strength with suppressing emotions. While that may be interesting from a family psychotherapy perspective, it's not relevant to custody. It's a personal value system. It's within the culture of masculinity, culture of male. It can be a number of ethnic cultures as well, about you just don't share emotions. It's interesting that this was put in and framed that way in the vignette, again, suggesting that whoever wrote this vignette has a bias against the father and is sort of presenting issues from their own cultural or personal belief system, that suppressing your emotions and being strong and that is not a good thing, that we need to be open, and that's your Western, Northern European humanistic value system, and it's not the value system of many other cultures or many people, personal value systems, or religious value systems even. And so that humanistic psychology value of we need to express our emotions, that's something you can deal with in therapy, totally fine, because I like guidance-based strategies and I like kind of more emotional. I come from the Northern European humanistic culture. However, that's not a custody-related issue. And so parents have the right to parent. Then he took a protective role with his family. Why? When you see the word protective role, there must be a danger. So boom, the moment I see that protective role with his family, I duty to protect. Okay, what's the danger that he needs to protect his family from? So I'd be inquiring, is there physical danger? Is there some sort of emotional danger? What's the danger that he needs to be in a protective role with his family? That's an interesting reference. And if we have a borderline or vulnerable dark triad, and think more vulnerable dark triad than your classic if we have a borderline spectrum vulnerable dark triad, then they're going to be presenting as there being dangers where none exist. And so you'll get a flavor of all these sorts of threats and danger and protection and all these things. But when you look, there's no there. There's no actual danger. There's your persecutory thought disorder with the borderline. So, and then we pursued a career in law enforcement. And then, he misused the alcohol in his late teens. That's not relevant. and prominently suggests that whoever constructed this vignette or is doing the clinical interviews got captivated by the mother's seduction. That's one of the things about working with narcissists and borderlines, and why it's so important to have grounded professional knowledge and experience in working with personality disorders if you're going to be in the family courts. Not only do you have the highly manipulative dark personalities, but the narcissist and borderline are highly seductive. The narcissist does it with this grandiose and, glad handing and, oh, aren't we all just wonderful and great? And everybody kind of folds into that because they like that arrogance and that entitlement and grandiosity. And oftentimes they're very social and very wonderful. And so they get people on their side through this expansive emotion that they begin to share, and their sense of kind of arrogance and that sort of thing. The borderline does the other. She's very seductive. Typically, it's a woman, so she's very vulnerable and, oh, I'm in danger and stuff, and she gets people taking care of her. And so if you're a therapist working with borderline, you have to be very cautious about how seductive, emotionally, psychologically seductive they are, potentially due to past sex abuse trauma. There's a high association of borderline pathology with childhood sex abuse. And so potentially we're double pathologizing sex abuse little girls who grew up, never told anybody, never got treatment. And so they have difficulty in intimate relationships because of their childhood traumas that have never been resolved. And so they both have a number of ACEs. That's concerning. And so we want to look at what type of stress and trauma, childhood trauma they had. So let's go back and take a look at the beginnings of things. And so Sonia and Joe met in their early 20s, drawn together by a shared passion to help vulnerable people. There's a whole thing of helping, a police officer, okay, a nurse, mom's presenting as a desired, she's a virtuous victim. Now, is dad also presenting that way? I don't know. Both seek understanding and emotionally support, having carried emotional baggage from their own pasts, so they're going to be missing because of unresolved trauma. They quickly fall in love, impulsive after meeting at a community event where Sonia volunteers as a nurse and Joe is a police officer on duty. They marry 18 years ago, embarking on life together with hopes of supportive and loving family relationships. So they met in their early 20s. They're 40 years old now as they're presenting in. So they have a lot of resources and support that we're able to hold the family together for 20 years and raise 3 children. We got the youngest one still in process, so we got to stabilize this family out. They were expecting to have a normal family. Mom has gotten a medical degree, a nursing degree, so she can organize herself. Dad is in a police academy and now moving towards detective, so he can organize himself. So we got 2 fairly competent adults. Carried emotional baggage from their pasts. That's going to be unresolved trauma. They quickly fall in love. There's your impulsivity. And they marry 18 years ago. So it's a long and stable family. So their first child, Nick, is born. And Sonia experiences postpartum depression, relying heavily on Nick for emotional comfort. Joe hopes to shape Nick into a strong, athletic child, while Sonia is more nurturing and protective. Nick struggles with hyperactivity and focus, leading to an ADHD diagnosis. Sonia supports medication, while Joe is skeptical and believes Nick will outgrow these issues. Attempts to have another child cause tension. The strain of infertility and Sonia's depression affect the marriage. Eventually, Sonia becomes pregnant with Danielle, bringing initial joy, but also new stressors. So this has a lot of valuable information that is of concern. So first off, postpartum depression. I would question that. And so maybe it's postpartum depression, hormonal kinds of things. I'd want to look at its stability across time. If it continues after the postpartum period, then we might be talking depression, and that's going to fall directly into the borderline spectrum with the mother. So the fact that mother has depression issues is entirely consistent with your borderline vulnerable dark triad. And then she relies heavily on Nick for emotional comfort. Role reversal, that's really bad, really bad. The other feature about depressed mothers, again, I'm early childhood. They are like an early childhood mental health. They are the worst mothers you want. You do not want a depressed mother. That they're really, really bad. You're going to get attachment problems significantly. What you're going to find, because they're an overwhelmed parent, you're going to get an anxious avoidant attachment, which is low protest. Anxious ambivalent is high protest to get a parent involved. Low protest, anxious avoidant, is with an overwhelmed parent, where if the child makes increased protest, the parent goes further away. So the child learns to be low protest to keep the parent close. That's your depressed parent. Plus the face is just depressed. The child doesn't make eye contact. So there's a whole bunch of downloading of regulatory stuff that's really bad. So depressed parents in early childhood are extremely problematic from a mental health perspective. So I'm worried about attachment issues. And now we have the presenting problem is a 15-year-old with attachment pathology relative to his dad. And mom in a role reversal relationship with him. Yeah, we're looking at a borderline spectrum mom and attachment issues, and then the attachment pathology being induced relative to the father to meet the mother's own needs. So we're looking at a factitious attachment pathology imposed on the child, and I want to look at the persecutory thought disorder. Look how fast into the vignette the differential diagnosis is sort of popping up. Then again, the word protective, and I put a little star by that, is more nurturing. Why is the mother presenting that she's protective? What danger does the mother see that she feels the need to be protective? And is that an authentic danger? Does the father really represent an abuse risk to his children? Or is the father frustrated with the mother and is angry at the mother, wants to have a good relationship with his children, and the mother has a persecutory thought disorder from her own childhood trauma? So Nick struggles with hyperactivity and focus. Those are your anxiety systems. I'm going to question, given that I have a postpartum depressed mother, I'm going to question whether that's actually ADHD or insecure attachment. Insecure, anxious, avoidant attachment. So we have a potential misdiagnosis of ADHD, and while saying the child has insecure attachment to the mother is not going to be pleasing to the mother, pathologizing the child with ADHD and allowing the mother to be a nurse with medication to her child bonds in a parent-child relationship. And who taught the mother how to be a mother? She had an emotionally neglectful childhood, so she may not feel very secure in being a mother. She feels inadequate, whole borderline spectrum. So having a medicalized child and taking care of the child's vulnerabilities may be her way of being the wonderful parent and fulfilling what she idealizes the mother role to be. So again, we potentially, and that since we're worried about a factitious attachment pathology imposed on the child, then a factitious ADHD imposed on the child would be within the scope of that as well, with medication. And notice Joe is skeptical and believes Nick will outgrow these issues. Now, the father's perspective may be more consistent with the anxiety of an attachment disorder. He may have a different quality of relationship, and so he may not be seeing the types of insecure attachment, anxiety kind of issues or whatever that the mother or the child is being used as a regulatory object for the mother. So she induces the type of symptoms she wants. Whereas with the dad, he doesn't see that because he's not inducing the symptoms. Okay, if you're going to see ADHD, you're going to see it in multiple places. You're going to see it in school with both parents. Everybody's reporting this child is really restless, and then interventions in the relationship won't have any impact on that. So, yeah, we're worried that dad doesn't see it, but then you're going to have a source of conflict now because mom is pathologized, or we have a child with pathology, the ADHD, and she's going to want to medication and take care of that. She's a nurse, and dad is saying, no, you need to be stronger. So you're going to get conflict that mom can then exploit in that situation. The dad's not understanding of the child's vulnerabilities and put the dad in this role of being harsh, overly harsh, and not sufficiently understanding of the children. And interesting about a lot of children do outgrow ADHD. It's a developmental lag hypothesis, but get into that some other time. Attempts to have another child cause tension. The strains of infertility and Sonia's depression affect the marriage, and so not the postpartum depression apparently has extended past postpartum and is affecting the marriage. So that the fact brings up two concerns. First, that the mother presented as postpartum depression as opposed to a longer standing depression. So she's trying to mask her presentation or adjust her presentation to appear more functional than she actually is. And then we have a severely depressed mother. That's going to draw caregiving from the child. And it's already said that she's turning to Nick for support. So we're worried about a role reversal and mother using the child as a regulatory object. Now, for the rest of us, normal kind of self-structure, we develop the capacity to self-regulate through a variety of ways. So when we're hit with emotions, we can self-regulate our emotions. For the narcissist or borderline or damaged personality, damaged self-structure, they don't have the capacity for self-regulation. So they have to grab somebody and grab like the child and pull them into their regulatory system and use the child to help them regulate. So they actually absorb the child into themselves, which severely damages the child's independence, the child's sense of self-identity, because they're being used as part of a regulatory system for another human being. And so that's very destructive and problematic with this. And so if I got a depressed mother, I'm really, really worried about that. So now going back to the description again of the postpartum depression and alignment, that after Danny's birth, Sonia's postpartum anxiety and depression resurfaced. So she's got high anxiety. That's when you have a parent signaling anxiety, anxiety is a signal of danger. So you have a mother who's signaling predators. There's a predator around. That's going to activate the child's attachment networks to stay close to the mother. So she is artificially inducing her eldest son, Nick, into staying close to her. And then by signaling anxiety, she's putting him in a protective role of her. So now she's got a role reversal on him. And then she's all depressed and incapacitated. So everybody has to take care of her. We're looking at vulnerable narcissism, highly manipulative and borderline spectrum. So yeah, we're looking at a dark triad, a vulnerable dark triad. So then, Sonia invests deeply in Nick, finding comfort and purpose in caring for him while distancing from Joe. Joe becomes frustrated by the emotional demands and Sonia's unavailability, turning to alcohol for relief. Danny begins to align more with Joe, adopting his mannerisms as Sonia remains focused on Nick and emotionally withdrawn. So the family has now split. Okay, we've split into Danny more on dad, bonding to dad, and Nick bonding to mother. It sounds like the mother has incorporated Nick as a regulatory object to stabilize her own thing, and that Danny has insecure attachment. But she's insecure. Danny is insecure, anxious, ambivalent. So she's presenting high protest in this, questioning her gender, aligning over more with dad. In aligning more with dad, it's likely that mom is not available. Mom is either depressed or wrapped up in Nick. So Danny doesn't have an attachment bond. So she turned to her dad for attachment bonding, But how does she attach to a dad who's more masculine? He doesn't have the oxytocin, primary maternal preoccupation stuff that we would want for early childhood. So she found a way to bond to him around his values, masculine values, and being a boy, and he wants a boy, and I'll be your boy for you. Would you please love me? So Danny's just seeking love because it's not available for mom. Mom's too wrapped up in her depression and Nick, so she's over with. That's not a cross generational coalition. That's attachment pathology in the family. Dad is not seducing his daughter into a coalition to use for additional power with the mother. The daughter is just bonding into him because of mother's problems. And you can see, going back to the gender and the 4 different roles, if Danny is on the identity bond, the same gender identity bond with her mother, and her mother is unavailable, then she's going to have kind of messed up identity, and then she goes over to dad. And so the identity features, I would put them as, I'd be less concerned about gender questioning and gender identity, 7, 8 years old, and highly concerned about the family dynamics. So while I get consulting with LGBT community, I'm actually going to move the gender identity kind of off to the side and fix the family stuff first. Fix the family stuff first, and then we can deal with that in adolescence and see what happens off of that. So, but she's got the high protest, anxious, which is caused by a parent who is inconsistently available. So the child emits high protest to get that parent over and attending to them, so that when the predator comes by, it goes eats the other kid because your parent's attending to you. Nick, on the other hand, has the low protest variant, the anxious avoidant, because that's the best way of keeping an overwhelmed mother close, because if he protests, she's going to vanish. So he's very self-reliant and is even in a caretaking role with his mother. And so the anxiety and depression. So yeah, I'm really concerned about the mother's parenting and the fact that she invests deeply. And in Nick, that is extraordinarily problematic. She's replaced her husband with Nick. Oh, you're talking about that Oedipal thing? Okay, so she's now, that's a spouse. Nick's her spouse. So we got a little psychological incest undercurrents there, which raised the concern that the mother was sexually abused as a child, because we have the cross-gender special relationship that excludes the other parent. The other variant of that is the father and the daughter that excludes the mother. That's your classic incest pattern. Okay, that's your father and the daughter have a special relationship that excludes your mother. Okay, now I'm not saying that that's a sexually abusive relationship. It's a ripple of sex abuse, but it's not a sexually abusive relationship. But it's going to be psychologically very difficult for that child to be replacing a spouse in the special affections of their parent. So we love high affection on the cross-gender bonds, father, daughter, mother, son. We want lots of love going down those channels. Those are the high affection bonds. We always want the balancing influence of the same gender identity parent. So we want both parents involved in that child's life. If you cut out one, you're going to get problematic distortions relative to the child. So she invests deeply, finding comfort and purpose in caring for him. My goodness, the pathology is just significant. Role reversal, borderline mom, vulnerable dark triad. She's going to be manipulative, using the child as a regulatory object. Concerns for child psychological abuse are extreme. And getting some differentiation in the mom-son relationship, some boundaries, getting the father back in to help stabilize that son's psychological development. But he's distancing from Joe. Okay, and that's classic with enmeshment. So you get enmeshment in one relationship, and then you'll get the distancing or disengagement in the other to balance. So you'll see that pattern. Enmeshment in one, disengagement in the other. Here we have it. So we have the mother in a cross-generational coalition with Nick against the father, and creating an emotional cutoff in the relationship with the dad. So this is pretty classic family systems. Pretty classic personality pathology, pretty classic at this point. Delusional pathology with protections and stuff kind of going, and we'll see how that develops. Then Joe becomes frustrated and turns to alcohol for relief. Okay, so of course Joe's frustrated. He's living with a mom who's just totally invested in the firstborn son, ignoring him. He wants a wife. He wants to be involved with his son. She's, got the Nick, and Nick's rejecting a relationship with dad. So dad's very frustrated. The mom says, look how angry he is. But she's not working with him. She's not supporting his relationship. In fact, she wants him to kind of be away from Nick because that's her regulatory object. And so, yeah, he's frustrated. So he's being set up a little bit on this. And then when you have them say that he turned to alcohol again, is that the mother's narrative? So I'd want to know frequency. I'd want to know any DUIs, what's going on. Now, yes, he is in a police culture. Yes, we are concerned about alcohol use. Yes, we are concerned about IPV. So let's get a proper assessment on those and figure that out. But at the same time, if there's no there, then I'm looking at mom being highly manipulative and throwing out, he's alcohol, and then dad is put on the defensive, saying, I'm not alcoholic. But now all the focus is on him and not on the role reversal she has with Nick. So she's using diversionary tactics. Look over there, he's drinking alcohol. He misused alcohol in late teens, and then when the marriage fell on, he started to have 3 beers on the weekend. Okay. So we want more specificity on the alcohol. And if dad's abusing alcohol, that's child endangerment, and let's put it on a treatment plan, and potentially child neglect. But doesn't sound like the substance abuse would be neglectful. Then Danny begins to align. So is align cross-generational coalition? Kind of, but it sounds more like Danny is seeking love and can't get it from her mother. So again, that's a very interesting presentation by whoever developed this vignette, that instead of seeing it as Danny wants love and can't get it from her mother, so she's turning to her father, they're viewing it as an alignment similar to Nick's alignment with his mom. And they're totally different relationships kind of going. So I would question whether they have background in family systems and whether they have background in children. Attachment. Adopting his manners. Sonia remains focused on Nick and emotionally withdrawn. Okay, so yeah, I'm just super duper worried about this mother using Nick as a regulatory object. Otherwise, she's withdrawn, and if Nick protests, then she withdraws further. So she's got him now taken care of as a regulatory object, leaving Danny out to fend for herself. And so she's gone over to dad to try to get dad, and is trying to find ways of bonding to dad. So what we want to do in therapy is help Danny and dad develop more sensitive ways of bonding rather than bonding around dad's value system kind of thing. Help teach dad how to be a parent for a little girl. He probably never parented a little girl before in his life because we're only parents the first time. So help him learn that some attachment therapy. For the parents at this point too, I'd get emotionally focused therapy, couples therapy. From Sue Johnson. It's based on the attachment research, but adapted to couples. And we have a classic where mom's fleeing and dad's trying to pursue her, and then she feels overwhelmed, and then she flees more, and he tries to pursue more, and they get this bad pattern going. So emotionally focused therapy would be very helpful prior to the divorce. The marriage deteriorates into a cycle of blame and resentment. Each parent feels abandoned and misunderstood. Joe accuses Sonia of coddling Nick, undermining his authority, and driving a wedge between him and the children. He becomes verbally harsh and humiliating towards Sonia. Sonia, feeling suffocated and unloved, views Joe's temper and criticism as emotionally damaging, leading her to withdraw further. Their unexpected third child, Brian, is quiet and adaptable, often overlooked amid the parental conflict. The fundamental clash of parenting styles, Joe's disciplinarian approach versus Sonia's empathic style, exacerbates the marital discord and adversely affects all the children. So, first thing is we have the word abandoned. And so if you get abandoned as a symptom, you're thinking borderline. So it's in the family. Each parent feels abandoned. Mom feels abandoned, and then she's abandoning dad, and dad makes dad frustrated. So now he starts to pursue her, and she starts to flee, and driving a wedge between them. Sonia feels suffocated. Yep, she's fleeing and withdraws further, and yet the dad just wants a relationship with his wife, and she's making that difficult and using the child instead as her surrogate spouse. Their unexpected third child, quiet and adaptable. Now that's a presentation of attachment pathology, insecure, anxious, avoidant. Everybody thinks they're such wonderful kids because they're so self-reliant, take care of themselves. No, that's a pathological attachment. It's insecure, anxious, avoidant. The child goes extremely low protest, and it has to do with a overwhelmed parent, where if the child protests, the parent goes further away. So the child remains low protest. That's your best strategy for keeping a parent close. So we got a third attachment pathology in the youngest child. So we got the eldest one on what's a disorganized attachment relative to his father. The eldest son, Nick, has no organized strategy to bond to his father. That would be a disorganized attachment. Disorganized attachment is associated with either abusive or psychotic range parenting. So I've got a disorganized attachment in Nick towards his dad. I know there's psychotic or abusive range parenting somewhere in the family. Where? Borderline. The term borderline for that type of pathology comes from the 1930s. It meant they're on the borderline between neurotic and psychotic. We know they go into these persecutory delusions under stress. So we got a depressed borderline mom, and we got the disorganized attachment coming from Nick, and so we got child abuse is definitely on the table. Child psychological abuse relative to the mother in this situation. Then driving wedge for quiet, adaptable. Then the fundamental clash of parenting styles between Joe's disciplinarian approach and Sonia's empathetic approach. I'm calling bias. Okay, that is a inappropriate framing. Joe, there's no indication that Joe is a disciplinarian approach. He's just trying to bond to his children. There's no indications that he uses spanking or what the rules are in the family or anything else. And it's just that the mom presents him as harsh and presents him as angry, and he has a more masculine kind of thing. Cultural psychology, I would wonder if the interviewer on this was a woman. I would wonder about her countertransference issues relative to men and whether she feels, the interviewer feels threatened by a more masculine, dominating kind of presentation from a man. And so she presents him as disciplinarian and angry and temper kinds of thing, and mom as empathetic. I'm seriously concerned about whoever wrote this vignette. I'm not seeing mom as being empathy at all relative to Nick. If she's over involved with him, using him as a regulatory object, he's not supporting his independent relationship with dad or independence generally. That's not empathetic. But she's presenting as empathetic, and who's ever doing this is believing that. That's of a concern. If you believe a shared delusion, you become part of the shared delusion. And when that delusion is child abuse, you become part of the child abuse. So believing that the mother is empathetic instead of a role reversal, using the child as a regulatory object, I would be worried that whoever the clinician is that is constructing this believes a shared delusion and is participating in the mother's psychological abuse of the child by believing that the mother is empathic and not perceiving the level of pathology involved. Yeah, so then let's go back. So then Sonia's resentment towards Joe intensifies, leading to her to overprotect the children and deepen divisions. Nick aligns more with Sonia, resisting Joe's involvement and distancing from his father. Sonia and Joe argue fiercely over Nick's ADHD medication and appropriate care. Danny feels torn, drawn to Joe's interests, but anxious about his anger and resentful of Sonia's push for traditional femininity. Brian becomes increasingly overlooked as the conflict focuses on Nick and Danny. Joe accuses Sonia of undermining his relationship with the children, feeling powerless and losing control. So, what we have is resentment. That's come up several times. That's an interesting kind of issue. So, you see it resentment there, Sonia's resentment, then you see it that Joe's interest, but anxious about his anger and resentful, that Danny's resentful of Sonia. So, twice the word resentful has come up. So, let's take a look at what that means. Google resentment, bitter indignation at having been treated unfairly. So, has the mother been treated unfairly by the father? I'm not seeing it. Father wants to be loved. He wants to be loved by his son. He wants to be loved by his wife. I'm not seeing that she's being treated unfairly. She's very depressed and involved in a boundary dissolution, role reversal, enmeshed relationship with the child that is keeping the father at bay. Is the daughter being treated unfairly by the mother? Well, kind of, yeah, because the daughter wants to be loved and the mother is showing, special favoritism. What was the mother's reported history? That there was favoritism in the family. Now she's showing favoritism to Nick and totally ignoring Danny. So, yeah, I can see resentment as, the daughter is being harmed, is not being treated fairly by the mother. And is the father being treated unfairly by the mother and the son? The father wants to be loved and loved by his daughter. So, yeah, I would say the father and the daughter are being unfairly treated by the mother. I don't see where the mother is being unfairly treated by the father. So, in terms of the use of resentment, Sonia's resentment towards Joe doesn't make any sense. So I begin to look at a thought disorder. I begin to do a mental status exam to find out what exactly is what's her grievance relative to the father. And I'm going to start looking for a persecutory thought disorder, a fixed and false belief. Okay, here's persecutory thought disorder, a fixed and false belief that the mother is being malevolently treated in some way. Okay, is the mother being malevolently treated in some way? I'm not saying it. I'm saying a depressed mother who's using a child as a regulatory object, and the dad is trying to get a normal range, healthy spousal relationship in a normal range, healthy father-son relationship in a normal range, healthy family. They're arguing a lot about the ADHD. With this pathology, given everything that we're in the context of now, role reversal, the mother using a child as a regulatory, is it a factitious ADHD imposed on the child? Are we actually looking at an insecure, anxious, avoidant attachment relative to the mother? And that creates behavioral restlessness and difficulty concentrating for Nick that mimic the symptoms of ADHD that allow the mother then to do a caregiving role with medication in her nurse role, where she couldn't do that if it's an attachment pathology, which would then criticize her parenting in that situation. So we're in the zone of factitious disorders imposed on another. Then we got overprotection. Okay, she's overprotecting. What's the danger? Where's the danger? So I'm getting a high persecutory thought disorder within the family. No danger has yet to be identified, but we got all these people protecting something from danger, and there's no specificity as what the danger is. And so Nick aligns more with Sonia, resisting Joe's involvement. There's your attachment pathology. That's a disorganized attachment. The attachment system is a motivational system. All motivational systems have direction. That's eating, pain, pleasure, sex, attachment. All motivational systems motivate towards a direction. For the attachment system, it always motivates a child to bond to the parent because the other direction is death by starvation and predation. So that's the origins of a primary motivational system of the brain, is to motivate the child to bond to the parent. It has survival value. So if I've got a child who's resisting a parent or refusing a parent, that's child abuse somewhere. Either the father is abusing the child some way, getting the son to flee the father, not wanting to be with the father, which I'm not getting reports of, or the mother is creating a shared delusional disorder and a factitious attachment pathology in the child to meet her own emotional needs. That could be to manipulate the court once it gets out into the courts, but at this point, it could be spousal abuse against the father, using Nick as the weapon. It sounds more, though, it's the mother using Nick as a regulatory object for her own anxiety and depression, and as her spouse, as her intimate figure and her caregiver, and parentification and all sorts of bad stuff that would put it in this child psychological abuse range. So that would activate duty to protect. And so none of them have discussed issues of duty to protect at this point relative to these children. So then Danny, but she's anxious about his anger. Okay, we'll put the anger on the treatment plan and develop a bonding between Danny and their dad. That's wonderful. We want that high affection, father-daughter bond. That's a great bond. So let's get lots of affection going into Danny. Let's see if we can get some mom love coming to Danny. And she's resentful of Sonia. And I would question whether it's a traditional femininity. I think that's symbolic, for she would like an identity bond with her mother. She would like a loving bond with her mother, but her mother doesn't love her, so now she's rejecting that identity bond. But she'd like to get close to her mother, so I'd want to focus on the mother, move Nick out, move Danny in, move Nick over to dad, and realign the intimacy in the family, get it back on track. And then Brian becomes increasingly overlooked. Joe accuses Sonia of undermining his relationship with the children. So there's the father's allegation that the mother is creating a persecutory delusion and factitious attachment pathology. Now, the father didn't say those words because the father's not a psychologist. But if the father says the mother is undermining my relationship with the children, cross-generational coalition, look for shared persecutory delusion, look for factitious disorder using the child as a regulatory object. So we now we need to do a proper assessment on this, and the concerns are child abuse because you got the child rejecting a parent. And because we have all these loyalties in the family, I would want to point out Ivan Berzermeni-Nagy and Geraldine Spark, invisible loyalties. Berzermeni-Nagy is a family systems therapist known for contextual family systems therapy. And look, he's written the book on invisible loyalties. And that's exactly what we have in the family. We got Nick loyal to mom, Danny loyal to dad. So this would be like really valuable to know if you're going to work with these families, which raises competence issues. If you're not competent in family systems and you're trying to treat family systems, that's going to be a problem. And that's going to be a violation of ethical standards on competence. So if you're going to treat families, you need to know family systems. If you're going to treat delusional thought disorders, you need to know delusional thought disorders. And if you're going to treat attachment pathology, you need to know the attachment system. So, so Danny expresses a strong desire to be seen as a boy from a young age, insisting on non-feminine clothing, hairstyles, and activities. Yeah, I think that's a red herring, actually. I think she just wants to find a way to bond to dad, and is highlighting that she's not bonded to mother. Sonia seeks medical and expert opinions, receiving conflicting advice, and tries to impose more traditional girl roles. Yeah, she's seeking medical advice. Joe views Danny's gender questioning as a phase and is less concerned, focusing on allowing exploration without major intervention. By age 12, Danny's identity exploration, including they them pronouns, becomes more confusing to both parents. Sonia pushes for therapy for Danny, while Joe reluctantly supports it. So again, the parents are split, the children are being triangulated in the spousal conflict, with each parent taking a side, and mom is more nurturing, dad is more, Nick's going to outgrow it, Danny's going to outgrow it. So he may be minimizing a bit the difficulty with the children, and mother may be creating the pathology in Danny, or relative to the attachment pathology in Danny, and then Nick relative to the attachment pathology in Nick and his dad. So she expresses a strong desire to be seen as a boy from a young age. I would say the young age part is the attachment system. It's highly unusual for a very young child to begin to question gender identity. You have to understand where gender identity kind of comes from in the 3 and 4 year old age range, and it's not something that's going to be questioned for quite a while, because there's development going on. Gender doesn't really have a conceptual meaning for quite a while, but I would put it more in the attachment issues. Mom seeking medical and expert opinions. I'm worried about factitious disorder with mom, creating pathology in the child for her role as being the medical expert taking care of the children. And so she's in a comfortable role if she's taking care of a medicalized child. Dad is maybe minimizing, just saying it's a phase. And we have this situation going on for a long time. So Danny's now at age 12, and that puts her at the cusp of adolescence. So now at this point, we want consultation with an LGBTQ somebody, and get some additional information regarding that zone if you're not competent already in that zone. So, but gender identity, even if you're competent working with LGBTQ, you may not be with gender identity. So you'd want to get some consultation at 12 years old. We got adolescence, we got all puberty and the whole thing with that. Oh my goodness, we got, she's going to start her periods and go through puberty, and that's the same gender bond, identity bond with the mother. So we got a lot of issues just coming forward with developmental phase and attachment within the family as Danny enters adolescence. So then Brian remains quiet, adaptable, and easy, escaping direct parental demands, overshadowed by the focus on Nick and Danny. Brian's own identity and needs are neglected. He blends into the background, learning to adjust his behavior to avoid conflict. Nick tries to protect Brian, further reinforcing Brian's passive role and limiting his self-expression. There we have, the insecure, anxious, avoidant attachment. Identity in a 7, that's a fluid concept. So whoever is writing this has their own personal belief systems, but it's not anchored in child development for a variety of reasons. That it's an anxious, insecure attachment, anxious, avoidant. And he blends into the background, anxious, avoidant. Nick tries to protect. There's that word again, protect. Where's the danger coming from? I'm going to suggest it's just in the environment, because we have a mother with a persecutory thought disorder, limiting his self-expression. 7, 8 years old. Yeah, we limit children's self-expression at 7, 8 years old. I think we have a white Northern European humanistic cultural bias in the writer of these vignettes. So as the children grow older, Nick in the mid-teens, Danny in middle school, Brian in elementary, parental conflicts worsen. Sonia becomes more critical and resentful of Joy, relying heavily on Nick for emotional support and validation. Joe responds by becoming more authoritarian, pushing the children to conform to his expectations. Communication between Sonia and Joe becomes openly hostile, verbally abusive, damaging their authority and emotional stability. Sonia's overprotectiveness transforms into a deliberate attempt to alienate the children from Joe. Nick adopts her perspective, seeing himself as a protector of his siblings against their father. Danny's involvement with the individual therapist. She finds individual therapy a safe place and aligns with the individual therapist who frames her experiences as trauma. The therapist seeing herself as Danny's protector, limits communication with Sonia, and never contacts Joe, reinforcing Danny's isolation and mistrust from her parents. This is a convoluted bit of information here. So let's begin to unpack it. A couple double lines. You see duty to protect down there. If so, the conflict's worsening. Again, you got that resentful word. So I'm beginning to look at who's being treated unfairly. But she's relying heavily on Nick for emotional support and validation. Yep, there's your role reversal using child regulatory object. And so we're going to get persecutory delusion off that. Joe responds by becoming more authoritarian. He's trying to take control of the situation. Things are spiraling out of control, and he's a masculine man, so he's a police officer. He's trying to take control of the situation, pushing his children. Okay, he's trying to find a way to navigate this way, pushing the children to conform to his expectations. That's a biased presentation of the father's position. I would question whoever wrote this as to whether or not they have a balanced perspective of the situation. Pressuring Nick into sports. The dad wants to have a normal father-son relationship. He wants his child to do sports. In the absence of child abuse, parents have the right to parent according to their personal values, cultural values, religious values. If the father likes sports, if the father wants to get his son involved with sports, that is totally okay. That's not pressuring your child to conform to there's a bias in whoever wrote this, whoever conceptualized this case in its presentation. So authoritarian, and then Sonia and Joe become openly hostile and verbally abusive. There's your word abuse. Verbally abusive. He's critical of, he's calling her names. But we got that abusive word, and so we got duty to protect at this point, all the way around. Is dad abusing the mother some way, in which case we have to protect the mother? Or is the mother psychologically abusing the dad by creating a damaged attachment bond with his son, using Nick as the weapon of spousal abuse? Is mother psychologically abusing Nick by creating a role reversal relationship and destroying his attachment bond to his dad? So we need a proper assessment on that clinical issue. Sonia's overprotectiveness, there's my shared delusion again, what's she protecting him from, transforms into a deliberate attempt to alienate. So when you get the word alienation, there's no such thing as parental alienation. There's no such thing as parent-child contact problems. There's no such thing as resist-refuse dynamic. Use the DSM-5, please. When you get the word alienation, what the general public means by that is a shared persecutory delusion and a factitious attachment pathology imposed on the child for secondary gain to a narcissistic, borderline, dark personality parent. So translate what they're saying into professional level language. So we're worried about delusional disorder. We're worried about factitious disorder imposed on another. That needs a proper risk assessment for child abuse, because either one of those or both together is a diagnosis of child psychological abuse by the mother. So we may have child abuse by the mother that activates duty to protect obligations. Whenever there's any of three dangerous pathologies, suicide, homicide, or abuse, child abuse, spousal abuse, or elder abuse, duty to protect obligations are active, and the psychologist has to do three things. First, they either have to personally conduct a proper risk assessment for the danger, suicide abuse or suicide assessment for suicide danger, or spousal abuse or child abuse, or ensure that one gets conducted, such as referring a child abuse case to Child Protective Services. Number two is they must take some affirmative protective action okay, to make sure everybody's safe, such as seeing the clients on a more frequent basis. And 3 is they must chart in the patient's medical record what affirmative action they took. At this point, given that we have allegations of abuse, given that the symptom patterns are jumping up on this, we have potential spousal abuse of the father, we have potential child abuse of Nick, and we got allegations from the mother that father is being spousal abuse of the mother. So, and she's overprotective, so she's protecting from something. So we need to get a proper risk assessment and find out what's going on in the family. Duty to protect is active. Alienate, Nick adopts her perspective. There's your shared persecutory delusion, sees himself as a protector of his siblings against their father. So there's your persecutory belief. Do Danny and Brian need to be protected from her father? There's no indication of that. And yet Nick believes he needs to protect them from his father. Where does Nick get that? Because he's adopting the mother's beliefs. It says right there, he adopts her perspective. She's afraid the younger children are being malevolently treated by their dad. That's your persecutory delusion. From the American Psychiatric Association, here's the definition. Persecutory type: delusions that the person or someone to whom the person is close, such as Danny and Brian, is being malevolently treated in some way. Google malevolent, having or showing a wish to do harm or evil. So does the father have a wish to do evil to his children? No, he does not. So by any reporting that we have here, he seems like a normal range dad, 20-year marriage, police officer married to a nurse. Does not have a desire to abuse his children. And yet we have the eldest son protecting the younger 2 children from him. Persecutory thought disorder. Okay, there it is. Betrayal and divorce. Oh my goodness, we're just up to the divorce. Sonia's affair with Danny's best friend father becomes the breaking point in their marriage. Nick, 14 and a half, and Danny, nearly 12, witness their mother's indiscretion, deepening their confusion and distrust. So mom has an affair with Danny's the father of Danny's best friend. Deepening their confusion and mistrust. Sonia and Joe's accusations escalate. Sonia calls Joe harsh and damaging, while Joe calls Sonia emotionally unstable and unfit, blaming her for the family's emotional turmoil. Both parents engage in combative attorneys, setting the stage for contentious custody battle. With Joe moved out, communication between the parents occurs only through their attorneys. Nick grows more resistant towards Joe. Danny feels torn between parents' expectations. Brian remains quietly confused. Legal battles strain family financial resources and further fracture trust and cooperation. Each parent enlists family members to support their narrative. Sonia's supporters encourage her to push for traditional femininity in Danny and validate her grievances against Joe. Joe's supporters defend his tough love approach, rationalizing the pressure on Nick and Danny and reinforcing his adversarial stance. So I would offer that whoever constructed this vignette is biased in the favor of the mother. They are minimizing the extent of the mother's pathology and appear to be over-pathologizing the father in their presentation. So I think let's go take a look at what this looks like. We have betrayal as a word. Betrayal is a classic symptom feature of sex abuse. So I've got another sex abuse indicator within the family. Now, do I believe any of the children are being sexually abused? No, but I believe there has been sex abuse somewhere in the family system. I'm going to hypothesize it's with the mother because of the emotionally neglectful parenting she received as a child. So we have the theme of betrayal within the family. And so we have Sonia's affair with Danny's best friend. Extremely poor judgment for a mother to have an affair with the father of your daughter's best friend. Okay, that's extremely bad parental judgment, consistent with a borderline emotional impulsivity. So we're looking at vulnerable dark triad. Both the children witness their mother's indiscretion. Oh my goodness, loyalties all over the place, deepening their confusion and distrust. I think those are mild words for it. Confusion. Oh my goodness. The family is just fracturing apart because of the mother's indiscretion of having a sexual affair while she's married to the father. Sonia calls Joe harsh and damaging. Wait a minute. The mother had an affair with the father of her daughter's best friend, and she's complaining about the father being upset about that he's harsh, and she's presenting as a virtuous victim. She's not a victim. She was the one who did that. And now the dad's angry about that. And that's completely understandable. And then dad, though, calls her emotionally unstable and unfit. So the emotionally unstable is your borderline, vulnerable dark triad, and the unfit would be the child psychological abuse and the role reversal relationship with Nick. So based on the symptom reporting, the dad's perception seems relatively accurate. Nick grows more resistant while Danny feels torn between expectations. Danny's not torn between expectations. Danny wants mom's love, and she got an insecure attachment with mom, and so she's bonding into dad, and they're fighting over things. And so it's not that she's torn between expectations. That I'm not clear on what theoretical orientation is being used to present this information. But if Nick is becoming more resistant, that the attachment pathology is increasing. So we need to get on this. Legal battles drain the family financial resources. Yeah, that's geez Louise. Let's get this in the mental health system, get it treated, and get it out of the courts. Further fracturing trust and cooperation. Cooperation has never been present in this family, parental cooperation. And trust has never been present in this family. Trust is something, again, associated with sex abuse. That's a violation of the trust. So I'm getting all sorts of sex abuse themes without actual sex abuse in the family. So again, I'm thinking mom is a carrier, and that would put it consistent with borderline, consistent with persecutory thought disorder, and using a child as a role reversal regulatory object. Then we have entrenchment and allies coming forward, cross-generational coalitions, emotional cutoffs, triangulation, inverted hierarchy, child judging the parent as if the parent was a child was a parent, enmeshment and mother-son relationship. Each parent listens to support their narrative. Again, I'm going to suggest bias by whoever came up with this, because it's not a narrative. It's they're giving the symptom information, and it's up to you to interpret the symptom information. Okay, this is not a narrative they're presenting. There's symptoms they're presenting. So there's a lack of, and I'm not hearing a diagnostic information being presented. And increasing and reinforcing his adversarial stance. So it's the father who's being adversarial because he wants to have a relationship with his son that's not involved with the mother. I'm going to suggest bias. Beginning of the court intervention. Sonia files for divorce, seeking primary custody by citing Joe's temper and substance issues. Okay, so she's citing his alcohol. There it comes. It's coming out of mom. And Joe's temper that she's provoking. So, yeah. Then Joe counters with alienation claims, demanding shared custody. Joe's demanding shared custody. He's claiming mom's creating a delusional thought disorder and factitious attachment pathology. The court sets temporary shared parenting orders, requires Joe to address alcohol issues via sober link and therapy, and appoints a parenting plan evaluator to investigate and recommend a long-term custody arrangement. Danny's involvement with the individual therapy, her individual therapist frames her experiences as traumatic and positions herself as Danny's sole protector. The therapist limits communication with Sonia and does not involve Joe, reinforcing Danny's isolation and mistrust of her parents. And then the parenting plan evaluator's report shows both parents contributing to dysfunction. Okay. Joe's anger is concerning, but not dangerous. Sonia's enmeshment with Nick is problematic. Yeah, I'd say. The evaluator recommends counseling parenting classes in the 50-50 custody arrangement with conditions such as alcohol monitoring for Joe. Each child needs are highlighted. Nick for autonomous boundaries, Danny for identity support, Brian for self-expression. Okay, so first off, it's interesting. Sonia files for divorce. So she's went off to have an affair, so now she's leaving dad. Because of his temper and substance abuse. So I'm worried about manipulation and these false allegations to put the focus on dad rather than her cross-generational coalition with Nick. Dad says it's alienation, so the mental health professionals should immediately pop into delusional thought disorder and persecutory type and factitious attachment pathology, demanding shared custody. So dad wants shared. Mom is wanting sole. That indicates mom absence of empathy for relative to the children and the role of a dad in the children's lives. Now, interestingly, they required Joe to address his alcohol issues via SoberLink. Now, there's two issues with that. First, I'm not convinced yet Dad has alcohol issues. He drank in, late adolescence, and then there's reports he started drinking more during the spousal conflict. But I don't know what his current drinking is. There's no frequency. So I'm concerned that this is a false allegation, manipulative allegation used by the mother to try to denigrate the father and make him seem dangerous and terrifying, and that she needs to protect the children from, his anger, and that's a persecutory thought disorder. The second kind of questionable issue I have with it is not only is it of questionable value including it and whether or not it should have been included in the monitoring. If you want to monitor, but that's saying he has a problem. So does he? Has that been documented yet? But then putting the advertiser for the whole program, the whole 8 modules was sponsored by SoberLink. There was no reason to include SoberLink in your slide. Okay, that's just a little kind of boundaries between marketing for SoberLink in your presentation that I find a little uncomfortable. And then points a parenting plan evaluator, custody evaluator for long-term custody arrangement. Long-term custody arrangement. Now, doctors should not be making custody decisions. They should be diagnosing and treating pathology. Custody is a court's decision. So we had a custody evaluation at this point. Okay. Then we get the individual therapist is saying things as traumatic. And I would say this family is dealing with trauma. We have the unresolved trauma in both parents. Anytime you get the symptoms of extreme with anything, you're in the world of trauma. And this family has extreme conflict within it, extreme attachment pathology, child projecting a parent. And then she sees herself as the sole protector of Danny. So now, if the individual therapist sees herself as a protector of her client, that duty to protect. You have a duty to protect. So conduct a proper assessment or ensure that one gets conducted for whatever the danger you believe is present. Take an affirmative protective action, such as seeing the child more regularly, meet with the parents, make a referral to CPS, whatever protective action that needs to happen off of this, of your concerns that you need to protect the child from this trauma experience, and then chart that in the patient's medical record. Uncovering the truth. Interesting. Now, if we're dealing with a delusional thought disorder, it's interesting that they would say we're having to uncover the truth. The parenting plan evaluator's report shows both parents contributing to the dysfunction. Based on the symptom reporting, I'm thinking the mother is pretty much primarily responsible for Nick's severe pathology, which is creating the problems in the father-son bond that's getting the father involved as well. And so the father is reactive to what the mother is creating in Nick, the false, factitious attachment pathology and the role reversal. So I would argue that that's incorrect, that opinion of the custody evaluation, based on what I'm seeing in symptoms, is incorrect. And Joe's anger is concerning, but not dangerous. First off, his anger seems to be normal range. This is really important to him. He loves his children. He used to love his wife. He wanted a family. He wanted a bond to his wife, and that was being frustrated. So he was getting angry from his frustration because these things are important to him. So it's not concerning, but it's definitely not dangerous. Then we'd have no child abuse by the father, no child abuse risk by the father, and the custody recommendation is for 50-50 shared custody. Okay, so the custody evaluator says the father represents no danger, yet the mother believes it is. She has Nick protecting the two younger children. There's your persecutory delusion. Did the custody evaluator conduct a proper risk assessment for possible delusional thought disorder and factitious disorder? Either one of both of those, or is a child psychological abuse diagnosis. Did the custody evaluator fail in their duty to protect obligations? Did they fail to conduct a proper risk assessment for the dangers involved? By all appearances, yes. And what's their diagnosis? We don't have a diagnosis. I will argue they misdiagnosed the pathology. So the custody evaluator would need to improve their standards of practice before we can even evaluate whether they misdiagnosed the pathology. So the custody evaluator is actually right now practicing below the level of misdiagnosis because we can't even evaluate whether or not they misdiagnosed it. Of course they missed the diagnosis because they didn't diagnose anything. So basically, yes, they misdiagnosed the pathology. They didn't even rule out delusional thought disorder, rule out factitious disorder as a possibility. They failure in duty to protect and misdiagnosed the pathology. And then traumatic, and that both parents, not dangerous. Sonia's enmeshment with Nick is problematic. Okay, I'm going to say that whoever wrote this is minimizing the mother's symptoms and overinflating the father's to make them both equivalent when they are not. The mother is, based on description, extraordinarily pathological. We're looking at a borderline personality disorder, more likely a vulnerable dark triad. A personality who's creating a false factitious disorder imposed on the child and a shared persecutory delusion in the child for secondary gain to meet our own needs. And we got a father who's a normal range dad. Okay, a little bit on the masculine side within the culture of the police, but a normal range dad that presents no danger to his children, and yet mother is having Nick protect the two younger children from the father. Okay, so dad's not dangerous, mom is problematic, and who's ever presenting this saying it's both, and one is concerning and the other is problematic, that's covering up the nature of the pathology with the mother and over pathologizing the father. But then they recommended counseling, parenting classes, and 50-50 custody arrangement. What was the purpose of an evaluation? I could have told you going into that evaluation that the family should get counseling, that parenting classes. You think parenting classes are going to work with this family? Nah. Okay, so counseling and then 50-50 custody. In the absence of child abuse, each parent should have as much time and involvement with the child as possible. So it works out to 50-50 basically. So we could have determined all of this ahead of time. We just need to know if dad is abusively maltreating the children. No, he's not. Okay, then the family gets into counseling and we get 50-50 custody. Unless mom is abusing the child, which is what dad is alleging with parental alienation. He's alleging she's creating a delusional thought disorder and factitious attachment pathology, child psychological abuse. So both parents are alleging abuse, so let's get a proper assessment on it. Instead, they got a forensic custody evaluation that was a complete waste of time. Waste of time and money to get recommendations for counseling and a parenting course and 50-50 custody. Really? That was what your assessment was designed to produce? And that's all? You didn't evaluate for the delusion? You didn't evaluate for the child abuse by the mother and nothing like that? All right. And then alcohol monitoring through sober, like I have questions about that. And then for Nick, it's autonomy and boundaries. Yeah, he's in the meshed relationship with mother. So, and for it's identity support. No, it's not. It's for attachment bonding to her mother. Okay, they are just not looking at the attachment pathology and putting this all in the children, as if the children have identities, and that those are symptom features. Those are not the cause of the issue. And self-expression for Brian, again, that's an attachment pathology, insecure, anxious, avoidant. So I would question whether these people who developed this and conducted the custody evaluation are competent in attachment pathology, because they're just totally missing on all elements of attachment pathology and framing us up as all sorts of other kinds of issues. So where do we go from here? There's a legal standoff. Both Sonia and Joy enter heated legal battle, each side highlighting the other's weaknesses. Sonia views the evaluator's recommendations of 50-50 times as misguided, while Joe's attorney emphasizes Joe's efforts and improvements. Improvements in what? The attorneys intensify the conflict, depicting each client as the better parent and the other parent is harmful. Well, is the other parent harmful? Is the mother harmful? Resist refuse dynamic. There's no such thing. Nick's refusal. Nick at 15 refuses to spend time with Joe, saying it was harmful and controlling. He's not. That's a persecutory delusion. He's not dangerous, and blames him for the family turmoil, and controlling is one of the ACS themes. Danny maintains balanced contact with both parents, albeit conflicted, while Brian quietly expresses missing his father when at Sonia's. So the father is not abusive. The two younger children are bonded into him. The fact that the eldest son believes the father is malevolently treating him some way and potentially will malevolently treat the younger two children is a persecutory thought disorder, likely caused by the mother. And so it's the symptom reporting is 100% consistent with a persecutory delusion, factitious disorder, and child psychological abuse by the mother, and it's not being addressed. Joe accuses Sonia of enabling Nick's refusal and files a contempt motion, escalating legal tensions and emotional strife within the family. Then 1 year post-separation, court mandates family therapy, requiring both parents to acknowledge their roles in the family situation. While both sign agreements to support a relationship with both parents for the children, Joe remains unsure of his own contribution to the issue, and Sonia doubts her influence on Nick's resistance. Okay. Heated legal battles. It's gone to the court system, and that's what did the custody evaluation do? What benefit was that? We needed to get this out to a diagnosis and into treatment, and a year later, finally, the court orders family therapy that should have been initiated right away because we're worried about possible child abuse, either by the dad because Nick's trying to get away from him, or more likely in this situation by the mother who's creating a persecutory delusion, factitious disorder in the child. So mom looks at 50-50 time and sees that misguided, even though that's a professional, that's a psychologist who conducted this, and so she's discounting the opinion of a psychologist, a fixed and false belief maintained despite contrary evidence. The contrary evidence is the opinion of the psychologist who did the assessment. The father is not dangerous. Mother doesn't believe it. Persecutory delusion. And yet we have the father getting improvements. I'm not sure what the father needs to improve. I have not had reporting yet of anything that's outside normal range parenting. Parents have the right to parent according to personal values, religious values, cultural values, and everything the father has been wanting is within the scope of personal values and potentially cultural values and potentially religious values. So what I'm looking at is an attachment pathology, disorganized attachment with Nick and his dad, and a persecutory thought disorder and factitious disorder imposed on another. All those are child psychological abuse by the mother of Nick. At 15, he refuses to spend time with his dad. There we go. There's your severe attachment pathology because he views his dad as harmful, persecutory delusion, and controlling. That's ACS. I think it's 7 for the themes for the rejection. Danny maintains balanced contact, and Brian says he misses his dad. So 2 other kids are bonded to their dad. That's not problem's not the dad. And everything talks about how mom's using the child as a regulatory object. And then Joe accuses mom of enabling Nick's refusal. So there's your factitious disorder and persecutory delusion, and files a contempt motion. Now, I highlighted the contempt motion. Everyone should always follow court orders. All adults should always follow court orders. All children should always follow court orders. If somebody is not following court orders, there's pathology in that somebody. Okay, so if dad has to go back for contempt, that's extremely concerning for mom and her parenting, that she can't follow court orders, and that's consistent with borderline, that don't accept limits on themselves, and narcissists don't accept limits on themselves. This discounting the psychologist and the 50-50 recommendations and the court order. Mom's a little out of control here. So she's really wrapped up in using Nick as a regulatory object. So we need to get some protection into Nick on that contempt. And that's ACS 12, is disregard of court orders. Then 1 year, the court mandates family therapy. So we lost an entire year of this family when you could have read this with Braille that this family is going to need family therapy. And it takes a year, and we got possible child abuse. We should have an assessment and diagnosis within 6 to 8 weeks. I'd like it within 4 to 6 weeks, but I'll take 6 to 8 weeks. For a family like this, okay, but by 8 weeks, we can get a diagnosis on that. That's 2 months, not a year, so that we can begin a treatment plan and fix the problem, protect people. But the judge requires both parents to acknowledge their roles. The judge didn't diagnose this pathology. The judge doesn't know that, they were relying on the recommendations of the custody evaluator, who said both parents are doing it, because the custody evaluator withheld diagnostic information from the court. They withheld that the mother has a persecutory thought disorder. They withheld that the child was being psychologically abused by the mother, because they didn't even assess for that. Okay, so there's negligence on the assessment, and then there's just bad information going into the court. So I'd wonder about competence with the assessment of delusional thought disorders. I'd worry about competence with the assessment of attachment pathology. And so this is problematic. Whoever the involved mental health professional involved in this case is problematic. And then while both agree to sign, Joe remains unsure of his own contributions to the issues. I remain unsure of his contributions to the issues. From all indications, mom is creating persecutory thought disorder and factitious disorder in the child for secondary gain to the mother. So the father's perception appears accurate and reality-based. Sonia doubts her influence on Nick's resistance. Everything is based is that mother's perception is not based in reality. So she's just totally missing her role in creating this enmeshed relationship and creating the problems with the dad, even though the other two kids know. Persecutory delusion, a fixed and false belief maintained despite contrary evidence. There's plenty of contrary evidence. The dad is not abusing the children. He's not dangerous. So she doesn't see it. So that's, again, pretty clear. So that was the case presented in Module 1. In Module 7, the following information was provided, and I want to present this as well because it's concerning. Okay. So, evolved family scenario. This is from Module 7 with Doctors Ward, Sullivan, and Droy. Sonia and Joe experienced situational violence at the time of separation. All three children witnessed dad throwing an object at mom, which smashed against the wall. Nick went into protective mode and got very angry with dad. This issue and others were successfully dealt with in family therapy, which is now paused. Mom has rekindled her relationship with dad's friend's father. She is less depressed, but also less available. There is one incident of violence in this relationship, and mom decides to end the relationship. The kids had been seeing each parent and spending time together With this new incident and the breakdown in the second family unit, where boyfriend Steve was involved with the children, the kids become re-triggered. Nick starts refusing any contact with dad, saying he was a total jerk and other 15-year-old terms, and mom deserves someone much better. Mom, who had told the family therapist she was having doubts about his effectiveness, calls him to get him re-involved. Wow. Okay, so first there's situational violence, intimate partner violence at separation. Intimidation, basically. Father threw something in the direction of the mother. I'm not convinced yet he was throwing it at her, but he was pretty frustrated. Okay, but that's situational and in separation. So that's a type of IEP. We're not worried about that. We're worried about the terrorist version, real severe pathological, narcissistic, borderline dark. And I'm not getting any indications that dad has a narcissistic personality or dark triad, vulnerable dark, or dark tetrad. So now it's interesting that these issues and others were successfully dealt with in family therapy. Okay, keep that in mind. Family therapy was successful, which is now paused. Interesting. Why? Why is it being paused? Probably because it was so successful. Everything was fixed, right? Mom is less depressed. It doesn't say she's not depressed. She's less depressed, which suggests it's not postpartum depression. It's chronic depression, which is consistent with borderline, which means that the postpartum presentation earlier is a false presentation. It's not postpartum, and a misdiagnosis by the clinicians who were involved in claiming it's postpartum when it's actually chronic. Because she's not having kids now, but she's less depressed now. And also less available, which is going to be the anxious avoidant personality or attachment problem. And Danny's going to have a lot of problems because Danny's trying to bond to her mom. And then there's one incident of violence in the relationship with the new boyfriend, Steve. Excuse me? So she gets involved, has an affair with somebody while she's still married. She's still a mom in the family, gets an affair with her daughter's best friend's father, then gets a relationship with that, gets the children all involved with that, which shouldn't be. You get divorced first and you give them like a year, to get that separation to stand. You just don't pull in a new boyfriend, especially when it's a father of your daughter's best friend. Mom's judgment is extraordinarily bad. And there's violence where she breaks it off with this Steve guy. Either she's choosing bad guys or she's provoking these guys into their anger, which is consistent with borderline. Okay, so I'm really, really worried about mom. And then we got, so here now, when she's with Steve, the kids are going back and forth. So she's not using Nick as a regulatory object because she found a new spouse figure. She used Nick as a regulatory object and got him as the spouse relative to his father. That's that incest thing, the Oedipal victory. She gets a new boyfriend. She doesn't need him anymore because now but the moment she kicks the boyfriend out, she gets Nick back as her surrogate husband. Mom is problematic, and we need to get in there and do some protection on Nick. So yeah, then the last one, mom calls the therapist again and says, even though she was having doubts about the therapist's effectiveness. So this is from the successful therapy, and mom doesn't think it was successful. Okay, but she has no place else to turn. Now, here's the final slide. Mom refuses to accept that she has any responsibility for the family dynamics. Danny began staying at dad's only and encouraging Brian to do the same. She no longer wanted any part of the Nick and mom dyad and wanted to forge her identity in one place, and that was dad's house. Dad is frustrated and fed up with Nick's refusal to interact with him. He thinks therapy wasn't effective, and he sees no reason to apologize for what he had done, which was the therapist's recommendation. If there's a shared persecutory delusion, the treatment for that is not to validate the shared persecutory delusion by having the parent apologize for something that isn't true. Okay. Diagnosis guides treatment. By all indications, the father's a normal range dad and has nothing to apologize for. Okay. It's a shared induced persecutory delusion. If you believe a shared delusion as a mental health professional, you become part of the shared delusion. You become part of the pathology. And when the pathology is child abuse, you become part of the child abuse by validating to the child that their delusional beliefs are true. Okay, so I would worry about the involved family therapist being a participant in the spousal abuse of the dad, using the child as a weapon, and participant in the child abuse, psychological abuse of Nick, by validating to Nick that his false beliefs are indeed accurate. Okay. Okay. He thinks therapy wasn't effective, sees no reason to apologize, as this was all mom's fault and she was alienating the kids. Dad increasingly pulls Danny and Brian towards him, setting up activities on what would have otherwise been mom's parenting time. Kids all feel totally justified in their more entrenched positions. Additionally, Nick and Danny, who stay in communication, have read on the internet they are old enough to have their voices heard and make their own decisions about their lives. The family therapist has not been paid, and current unpaid balance by dad. The attorneys have gotten re-involved, each stating therapy didn't work well enough and a change in their parenting plan must occur. Danny has told a friend in confidence that she has begun self-harm, cutting arms and thighs, which the friend told to the school guidance counselor. Danny is still seeing her therapist, who believes the emotional trauma is manifesting anew. Okay, so mom refuses to accept responsibility. That's your persecutory delusion, a fixed and false belief maintained despite contrary evidence, and mom is clearly responsible for pretty much everything, I would think. The dad's a normal range dad. And is he normal? Yeah, but he's not the problem. And then Danny wants to stay away from the Nick mom dyad. There's your clear cross-generational coalition, and Danny's had enough of it, and she views mom as problematic, severely problematic, and Nick with her. And then dad is fed up with Nick's refusal because there's no reason for it, and then we got a persecutory delusion. And therapy wasn't effective. He sees no reason to apologize. I see no reason for him to apologize either, and therapy is obviously not effective, even though earlier they said family therapy had been successful and was now paused. So we have success. This is the result of successful family therapy from forensic psychologists. The family is just totally destroyed. Nothing got fixed. Nothing. And it just deteriorated more. And we got a delay in family therapy for a year, and then the family therapy was completely ineffective. Why is it paused with a family that's in such dire need? Dad says it's alienating again. So dad is telling the professionals it's a shared delusional disorder and false factitious attachment pathology and child psychological abuse. But the professionals are using made-up terms and made-up forms of pathology instead of applying established knowledge. And so they are just whiffing on the DSM-5 diagnoses that the father is alleging, because he's a layperson in the general public and not a trained psychologist. These folks are trained psychologists. They should be relying on the DSM-5, and they should be returning an accurate diagnosis, which I don't believe they did. And so we got duty to protect. The moment dad says this is alienation, we got duty to protect and assess whether it's a persecutory delusion. Now, the second paragraph. The family therapist has not been paid the current unpaid balance by dad. That's why it's paused. Dad is not happy with the therapy because the therapist is saying, you need to apologize. And dad said, didn't do anything to apologize for. And the therapist says, I don't care. Apologize anyway. Dad says, this is not effective. This is not working. I'm not going to pay for this therapy. So the therapy is paused. offer a referral to somebody. If he's not happy with your therapy, that's called informed consent to treatment. It's the consent part. So give them a referral to somebody who will provide them with an accurate diagnosis and effective treatment plan. Don't just pause therapy and leave this family out with nobody to where mom has to call you back again, even though mom doesn't like your therapy. And so this is a vulnerable population, and they are forced to use this one seemingly incompetent family therapist and are offered no other services other than this one seemingly incompetent therapist. And then, he stating therapy did not work well enough. And now we have self-harm by the child. So the situation has escalated. We got a full cutoff of Nick, and he's lost his entire developmental period, having that close bonded relationship with his father. We will never recover that father-son bond during childhood because now Nick is an adult. He's going to have damaged attachment and damaged self-identity for the rest of his life because the mental health people didn't diagnose and effectively treat it. And we got Danny, who's now self-cutting, which is a borderline personality symptom. So we got borderline personality somewhere in the family, and depression, and oh my goodness, it's in the mom, and nobody's diagnosing this, and nobody's protecting the children. We have failure and duty to protect. So in closing here, I just want to point out with the forensic evaluation that this was the first contact into the mental health system, and whoever the evaluator was fumbled it. That because they did not accurately diagnose the persecutory delusion and child psychological abuse and factitious attachment pathology and get a proper treatment plan for that, this family spiraled into dysfunction and pathology and destruction. So when we get the first contact with the mental health system, we got to get this out for a proper risk assessment so that we can protect children and don't let it go on for a year before the family therapist. Why did it take a year to get family therapy? My guess, because that prior year was spent on this custody evaluation. So basically it just poured cement in the treatment, waiting for this forensic custody evaluator to come back and say 50-50 custody and parenting course, and maybe they should get some counseling. I could have said everything rather than saved you all a year and a bunch of thousands of dollars. So that's problematic. And just recommended stuff that was just basic, and what a waste. The forensic custody, by all appearances, that custody evaluation provided no useful service to the family or to the court. In addition, the family therapy, they said it was successful and is now paused. There is no diagnosis reported for the family therapy. The treatment plan of having the father apologize and validate a persecutory delusion, it does not seem based on a treatment plan or any form of known psychotherapy. The father did not agree with the apology treatment plan being proposed, so you had the absence of consent to the treatment plan. Neither the father nor the mother believed the family therapy was helpful or successful, even though it's represented as being successful. And the father stopped paying for the family therapy because he did not agree with the treatment plan and did not think it was effective. And so the therapist just cut them off without referral to anybody else. And I'm thinking kind of patient abandonment, but fees and stuff. But my goodness, this is extraordinarily problematic. And Nick is now refusing a relationship with his father, and Danny has started self-injurious behavior of cutting. There was a duty to protect for all mental health professionals involved in this family. Based on the symptom reporting, everyone had a duty to protect, and a proper risk assessment for the differential diagnoses involved should have been conducted. Is the father abusively maltreating the children in some way? By all the assessments said nope, and there's no reporting that he was. Was the mother creating a shared persecutory delusion and factitious attachment pathology in the child for secondary gain to the mother? By all indications, yes. Was it assessed? No. Was it diagnosed? No. Was it treated? No. I would offer there was a negligent failure in duty to protect relative to all the involved mental health professionals. So with that, that's my case analysis of the AFCC training case that they used in their 8 modules on advanced issues in family law about parent-child contact problems, which is a made-up pathology label. People need to rely on the DSM-5 for their diagnostic formulations and professional judgments. Is there a shared persecutory delusion? Is there a factitious disorder imposed on another? Is there child psychological abuse by the allied parent? Or is there some sort of abuse by the targeted parent? One way or the other, we need an answer to that differential diagnosis. So with that, take care, everybody, and I'll be back to talk about some other aspect of family court pathology.